Hi everybody, this is Dr. Ravindran Kumeran from Apollo Firstmed Hospitals in Keel Park. In this episode, we're going to talk about emergencies which are associated with gallbladder stones. See, gallbladder is an organ which is associated with the biliary system, meaning the liver which produces bile, and it acts as a storage organ, often prone to developing stones, especially in women folk compared to men. These stones can sometimes be asymptomatic, meaning it is an incidental finding on an ultrasound scan which happens for another cause or maybe as a routine health check, or the patient presents for the first time with some symptom associated with the stone and it is picked up on further investigations for the pain. See, gallstones presenting as an emergencies can be quite tricky. See, patients often have intense abdominal pain, mostly at night. So we all have a sumptuous dinner, especially a rich meal, and we are woken up in the middle of the night with pain, usually in the central abdomen, upper central abdomen. Again, can mimic a heart attack, especially in elderly patient. They again get referred to the cardiologist, kind of put up an ICU, being investigated for heart issues. And it takes a while before they realize that it is actually the gallstone which is giving rise to the pain. Can be masked, especially in diabetic patients, because diabetic patients have this tendency of not perception differences there in pain for diabetic patients. So you can have a heart attack and often miss it sometimes in a diabetic patient because you don't realize that you've got pain. Same way, you can have a very diseased gallbladder which is almost gangrenous, and the patient can be sitting at home saying, I am, not feeling great, but not bad enough to be in hospital. That is the perception these diabetic patients can have. And this leads to patients coming into the hospital who are very sick. And they'll be very surprised when you tell them that their gangrenous gallbladder has to be removed. Or often you remove the gallbladder and show them that it is all green and really nasty, and they are unable to believe that they've been through so much of infection and yet not realizing what is happening. So gallstones can be a major issue, especially for elderly patients, to an extent where I would say if you have a person who's 60, 65 years and above with gallstones, or if you're a diabetic patient with gallstones, I think it is better to remove it even if they're completely asymptomatic, to avoid this possibility of having to have an emergency intervention when that particular patient may not be at the finest of their health. Thank you.